Hi everyone. Today we are going to be talking about chlamydia. That's the STD that I chose. So we'll go ahead and get started here. So what is chlamydia? Where does it come from? So we'll jump into that. Chlamydia is it's a bacteria. It's called Chlamydia trachomatis. It infects the reproductive tract and targets the epithelial tissues. In men, it is found in the semen, and women, it is found in the vaginal secretions. So who were the two scientists that found chlamydia? Their names are Halberstader and Prowazek. In 1907, they were on the island of Java in Indonesia. They were treating patients with trachoma. They were getting conjunctival samples, and they stumbled upon chlamydia once they found the Chlamydia trachomatis bacteria under the microscope. So here we are, 100 years later, chlamydia still exists, and it is one of the most common sexually transmitted bacterial diseases in the world. So chlamydia trachomatis, on the background of this slide, you can see this is what it looks like under the microscope. I'm just going to see if I can fix my thing here. There we go. This is what it looks like, and it's a gram-negative bacteria, so it does cause infection. And excuse me. And a host cell is needed for replication, so the Chlamydia trachomatis invades the reproductive tract. It attaches to the epithelial tissue, and the outside of the cell of the Chlamydia trachomatis bacterium attaches to the host cell of the person that's infected, and it starts to invade the DNA and then replicate. So this process happens within the first 6 to 8 hours of being infected. So that's pretty fast. However, you may be asymptomatic. So even though the infection happens very quickly after being contracted, you might not get any symptoms. But the Chlamydia trachomatis, that is commonly, you get that because it's from unprotected sex, either males, females, men to men, women to women, either, it doesn't matter. If you're sexually active and you're having unprotected sex, you can get chlamydia. All right, so the signs and symptoms, like I mentioned, most individuals are asymptomatic, so they might not show any signs, and sometimes it may take a couple of weeks and they will see some of these signs. Excuse me. So women, these are a few of the symptoms they might experience. So they may have some mucopurulent discharge, some clear yellowish secretions, vaginal secretions, urinary urgency, burning with urination, abdominal cramping and pain, and they may have spotting and bleeding as well. Men, they also will experience the similar signs and symptoms. However, they can experience pain and swelling in one or both testicles. And I might add for men as well, upon if the male is the infected individual, and men do not have to ejaculate for you to be able to contract the chlamydia from them. So that's something to definitely keep in mind when talking to patients and educating sexually active young individuals, old individuals. And also, for men and women, rectal infection can occur. So, rectal bleeding, pain, and discharge are all signs and symptoms of rectal chlamydia. So, what are the risk factors? Who is at risk the most, and how can they prevent it? What can they do? So, women especially, women 25 years old and younger that are sexually active are at the highest risk. They should be screened annually. Women older than 25 say they're newly sexually active with multiple partners, they are also at a high risk and should be annually screened. But anyone, male or female, having unprotected sex at any time is at risk, and they should be very vigilant on getting screened, not just for chlamydia, but for all STIs and STDs. Women who are pregnant can have chlamydia, just like any other STDs as well. So once becoming pregnant, it's important that they get screened. Make sure they don't have any STDs, STIs at the time of pregnancy. Make sure they're treated if they do. And because chlamydia for pregnant women, it can be passed on to their babies during delivery. For the babies, it would be a health illness such as like pneumonia, or they could get an eye infection. Also, it may induce them into early labor. And again, like we talked about earlier, gay and bisexual men and women are also at a pretty high risk for contracting chlamydia because you can get it rectally, in the penis, in the vagina. It does not any of the reproductive systems, but it's the epithelial tissues inside our rectum, inside the vaginal area, the penis. They're so sensitive. It's such a soft tissue that it's very susceptible to infection. Any kind of infection. Should always be very cautious, and we want to talk to our patients about staying on top of being screened. So for treatment, there is a cure. The most commonly used antibiotics are zithromax and doxycycline. So what will happen is if you suspect, or if you're in one of those high-risk categories, your doctor will use a lab test, like a urine test, or they'll use a cotton swab to, for example, they'll swab the vaginal secretions. And so once you're diagnosed with chlamydia, they will begin treatment with an antibiotic. There are others out there besides these because some may have allergies to these two antibiotics. It's important that the patients finish the entire antibiotic, and after the antibiotic is finished, it's important that they abstain from sex for 7 days afterwards. Also encourage any sexual partners that they've had to go ahead and get screened, and they possibly might need treatment themselves. And once the prescription is finished, follow up with their provider and make sure that the infection is gone. So what happens if we don't treat chlamydia? Some may not know that they have it and may go untreated. For men, it's typically does not, they'll have the uncomfortable signs and symptoms, maybe. They might not have those symptoms. But as far as long-term risks for male, like being infertile, that typically it's very rare. It is not the case for men. Usually they will not have any long-lasting effects. However, for women, there can be more permanent results of untreated chlamydia. For example, the infection will spread from it'll spread into the uterus, into the fallopian tubes, and this leads to pelvic inflammatory disease. Now, again, pelvic inflammatory disease may be asymptomatic as well, no symptoms, but it can have permanent damage on your reproductive system, so it may make them infertile. And another health illness from chlamydia would be you can get ectopic pregnancy, women can. So again, for men, it's very rare that it happens, but for women, it is especially important for them to understand that if they have chlamydia and it goes untreated, it can have long-lasting effects. So to summarize, like we've discussed, chlamydia is an infection in the reproductive tract. The best prevention is educating our patients who are sexually active, approaching sexually active. Talk to them about getting tested annually, even if they're not in the high risk category. If at any point in time that they feel like they should be screened, discuss with their provider, and the provider can make that call. And but at least there's education happening in there as well. Having that open and honest and trusting relationship, patient to doctors, is so important, especially when it comes to talking about STDs. It's not always the most comfortable topic, and it's very hard to be honest for everybody, so it's important that you develop that relationship and get that trusting relationship so the patient gets the education, the treatment that they may need. But also, there are vaccines to help prevent getting certain STDs. And so it's our job as healthcare professionals to advocate for vaccines and why they are so important. So these are great opportunities while discussing the education with the patients to furthermore talk to them about vaccinations and how it can keep them safe in the future. And also just always making sure, practice safe sex. And we'll go ahead here. I'll show you some of the references. So I used a few different resources here. I used Bioscience. Their website was wonderful. I was able to find the information on what kind of bacteria chlamydia was, and find out about the gram-negative piece, how it works within the cell, how it replicates, and its process. The Center for Disease Control and Prevention was a big one. I got a lot of information from that website. It's very user-friendly for patients, for doctors, for anybody. It is very easy to locate the information. It has everything listed in bullet points. Any frequently asked questions can all be answered on there. I also used my medical surgical nursing book, 9th edition. That was helpful as well. I was able to look at interventions, some medications that are common, signs and symptoms that are common, and see it from the nursing process point of view as well. So I encourage, if you have any questions or want to search more on your own, that you visit these resources and utilize them. They were a great help to me. All right. Well, thank you very much. And that sums up our discussion on chlamydia today. Have a great day, everyone. Thank you.